Today I am going to be talking to you about an important topic. It is diabetes in pregnancy. So what causes diabetes in pregnancy? In a pregnant woman, the placenta starts making hormones which push up the blood sugars. In a woman, normally there is enough amount of insulin that is produced from her pancreas that is able to neutralize or tackle this rise in blood sugar. Where the woman is unable to produce enough insulin to combat this blood sugar, or where she has a resistance, where the woman has developed resistance to the presence of insulin itself, then the blood sugar levels remain high and she becomes diabetic in pregnancy. It is very important we recognize this diabetes in pregnancy because it can affect the developing fetus as well as the mother, because a portion of these women develop blood pressure related complications in pregnancy as well. Not just this, a portion of these women will eventually become diabetic later in life. Usually, the doctor will give you a couple of tests related to sugars to diagnose this test. The gold standard for diagnosing diabetes in pregnancy is the 75 grams oral glucose tolerance test. One or more of values, if it is found to be abnormal, then you are considered diabetic in pregnancy and treatment is initiated. Treatment consists of two arms. One is the self care, second thing is medication. Under self care, we have two strategies for treating. One is the diet, other is physical activity. Under diet, please remember you are expected to have a low carbohydrate, moderate protein and a high fiber diet. High fiber diet is very important because it prevents absorption of excess sugars into the body. Also, please remember avoid fatty foods and foods rich in sugars. Now, exercise, some amount of moderate exercise per day will really help a long way in controlling the sugars. At least 20 minutes of exercise every day in the form of even moderate walking should be more than sufficient. Now, regarding medicines, that will be decided by your doctor in combination with a diabetologist. Either way, very strict control of blood sugars is very much important all through pregnancy because it will determine the outcome of the pregnancy itself. So, it completely depends upon several factors, both the timing and the mode of delivery will depend upon if you have had previous normal delivery, how good your glycemic controls have been, the estimated fetal weight and environmental, social, psychological and other factors. All through her life, she is expected to follow a strict lifestyle modification in the form of daily exercise, healthy diet, and she has to be under follow up with a doctor. Thank you.